Top of the hour. Good afternoon. Welcome to JoyNews Today. We're live on DSTV channel 421, Go TV channel 125 across all our social media handles. We're JoyNews on TV. Coming up this afternoon, minority in Parliament to summon Health Minister Dr. Okuboy to explain to the House how he intends to help cancer patients at COBUS Teaching Hospital, which has only one radiotherapy machine treating cancer patients.
It will come, if not then early next week. We should have prepared, officially raise the issue, and probably even invite the Minister of Health.
Also in this bulletin, Parliament gives approval for dual citizens to hold positions in Ghana. We're live in Parliament for details. And later, residents and commuters protest the poor nature of the Tema Ponda Road, asking government to fix the stretch immediately. There's business, sports, world news, and showbiz also in this package. My name is Faustina Safo. Do stay for details. Thanks for choosing us. We are your home of independent, fearless, and credible journalism. Now, we start from Parliament because the minority in Parliament is asking the Health Minister, Dr. Bernard Okuboy, to appear before the House to explain why the COBUS Teaching Hospital has only one radiotherapy machine, which has failed to serve the number of cancer patients at the hospital. Well, this follows concerns by patients that the radiotherapy machine often breaks down, forcing the hospital to delay treatment of cancer patients. We'll hear from the Deputy Ranking on Parliament's Health Committee shortly. First, here's a report by Rejoice Serenfakpesu telling the story at COBUS Teaching Hospital.
8-year-old Joshua is having one of his 33 sessions for the treatment of cancer.
Pain. I feel pain.
What do you want to become? You told me you love John Mahama. You can give a shout out to John Mahama. Anything you want to say to him?
President Jamama, please, can you help me with my treatment, please?
You are hoping to get back to school soon. Okay. You're hoping to get back to school?
Yes, of course. Yes, of course.
He's one of the lucky few, as many have been told to hold on with their treatment. Appointments for patients requiring more than 6 treatment sessions remain suspended as oncologists at the hospital await comprehensive maintenance on the radiotherapy machine, which is currently operational but limited to just 10 sessions per day.
The engineers posted here by the company, the local agents, they worked on the machine. They worked on the machine, and somehow they were able to get it back online. But they realized that when it stays on for a few hours, then the problem resurfaces. So then management has taken a decision that we are treating, as a stopgap measure, we are treating patients who have about 5 to 10 treatments left, right?
Professor Joel Yane is head of oncology department at the hospital.
We should pay attention to non-communicable disease and cancer in particular. Yes, because our disease profile is changing. It's not only Ghana, most developing countries, the disease profile is changing. They're having more non-communicable disease, more cancers. And radiotherapy plays a very important role in the management of cancer.
On the 4th of July 2024, patients arriving for the scheduled treatment were turned away as oncologists at the COBUS Teaching Hospital scrambled to bring engineers to repair the only radiotherapy machine, which had broken down due to excessive use. Some patients were worried.
I was scheduled for radiation treatment, which will take 16 working days. But I realized that they were having issues with their machine. I was scheduled last week, Thursday. I did a Thursday and Friday, and I'm supposed to continue from Monday up to date. After those 2 treatments that I had, I've never had any.
This incident occurred just days after oncologists at the COBUS Teaching Hospital withdrew their services in protest over delays in repairing the cancer treatment machine at their facility.
It is unfortunate that our colleagues, a section of our colleagues in oncology, have taken this action.
Professor Yene, having experienced the pain patients are going through, wants government to bring in more machines.
Government is aware and there's a master plan. Yeah, there's a master plan. The plan is to have associate, because it's very complex and cancer management is quite complex, we associate it with the teaching hospitals. So the plan we have now is to have one in Tamale, one in Cape Coast, and one in Ho, because they have medical schools, and therefore we'll have the human resource. People who do some cancer work, right? So these will be new centers. Then Konfanochi and Kolebu would have additional machines, so they will have 2 each, so that when such a problem arises, we can solve it. Unfortunately, we have not been able to implement our plan. Mind you, I told you that the machine costs getting to about $2 million.
Rejoice Semifakwesu's report for Joy News.
Well, we can now hear from Dr. Mark Kek Nawani, who is Deputy Ranking Member of Parliament's Health Committee.
So, this Agenda 111, which we have spent up to 3 billion or more on it, 3 billion Ghana cedis or more on it, couldn't we have used some of these resources to build or purchase some equipment which will be serving Ghana now than the Agenda 111, which has been spread all over the country, and I'm afraid probably not a single one might be commissioned before the end of the year.
How soon do we expect you to raise this issue on the floor?
Today is Friday. If possible, it will come. If not, then early next week, we should have prepared and officially raise the issue, and probably we invite the Minister of Health to come to the floor of Parliament and explain what is happening. Repairs and it breaks down. Repairs and it breaks down. Obviously, it will break down. We know, because if you are getting 60 patients a day to use a single machine, that is too much. I mean, even human beings will break down. How much more machines?
Let's stay in the health sector, because health experts are calling for immediate steps to avert a health crisis as non-communicable diseases continue to claim over 94,000 Ghanaian lives annually. Efforts include educating children about healthy eating, increasing healthy care funding, as well as encouraging physical activities to stem the tides of the silent epidemic. Emmanuel Jivenu has more from JoyNews' national dialogue on NCDs held yesterday.
Conditions like diabetes, hypertension, kidney failure and cancers are on the rise, yet efforts to address this growing issue are falling short.
If we don't take immediate action now, by 2030, Ghana will spend $6 billion every year on tackling NCDs.
Professor Gordon Abekan-Nkrumah with the Health Services Management Department of the University of Ghana Business School stressed the importance of aligning the fight against NCDs with the interests of decision makers.
How are we communicating NCDs to the elite who have the power to make decisions when it comes to resource allocation, say the Ministry of Finance, say Cabinet? The way we package this message and carve it around their own incentives in terms of how this determine their electoral fortunes.
The national coordinator of the Ghana NCD Alliance, Labra Musa, also urged President Akufo-Addo to give these chronic diseases a national attention.
One of the recommendations we made to the president, if he can, make non-communicable disease a national concern, within his outfit. We could all see that COVID was virtually taking the lives of people living with non-communicable diseases. So let's have interventions by the presidency, so at least we can have, he can do this for probably before he leaves office.
Family physician at the Greater Accra Regional Hospital, Dr. Jacqueline Thompson, wants children to be introduced to healthy diets to reduce their exposure to the NCDs.
You have to tell the rich kids to stop eating junk food. Then we have to get the poor kids to have more nutritious food to eat. So when it comes to the school feeding program, why don't we make it such that everybody is exposed to the same thing when they come to school, so that they have that? So if we say that this is what we've provided, 2/3 of your meal has to be fruits and vegetables, you don't have any other option, that's what you have to eat. If the unhealthy foods are not available, they'll be forced to eat it.
The health experts have been recommending a number of measures, including increasing healthcare funding, launching public awareness campaigns, and improving access to preventive care.
We need to begin to work together with key stakeholders to drum home the importance of, indulging in a very good habit of eating, doing physical activity. Where we live and work, we need to ensure that we make provision for people to exercise. And we've seen it in some places where they've dedicated a day or two for workers not to use the elevator or lift. You work through. These are little things, but that I can tell you, at the end, you are likely to benefit from it.
There is the need for a concerted effort to avert a health crisis. Emmanuel Jivenu, Joy News.
The Ghana Health Service says it is worried about how fast onchocerciasis and elephantiasis are becoming endemic in many districts in the country. Director General of the Ghana Health Service, Dr. Patrick Kumabwaji, says the service and its partners will begin an annual mass drug administration for people aged 5 and above in order to halt the transmission of the infection. There's more in this report by Adubi Asare.
Elephantiasis is a condition caused by parasitic worms, leading to severe swelling of the limbs or other parts of the body. Primarily transmitted through mosquito bites, it results in thickened skin and tissue, often causing disability and social stigma. River blindness or onchocerciasis is another parasitic disease transmitted through the bites of infected black flies. It can cause severe itching, skin nodules, and eye lesions, potentially leading to permanent blindness if untreated. Both diseases are endemic in 140 and 119 districts in Ghana. In view of this, the Ghana Health Service says it is ready to administer its annual mass drug to Ghanaians aged 5 and above to stop the transmission of the infections. Dr. Franklin Siedu Bekwin is Director of Public Health.
There's a lot of competing interests in the country, politics, sports, but we think that health is also premium. And we want you to use this forum to let the Ghanaian appreciate that health is wealth. And so that we know how best they can appreciate it. It's not easy to take medicines, but when you know the importance of it, then you take it.
Director General of the Ghana Health Service, Dr. Patrick Kumabwaji, emphasized the dangers of not receiving the medication and provides a breakdown of the exercise set to start on Monday, July 15.
As part of the process of eliminating both onchocerciasis and the lymphatic filariasis by the year 2030, the Ghana Health Service, working with our partners, the NCD program, is implementing this year's mass drug administration in 77 onchocerciasis endemic, that's the river blindness district, which occurs in almost all the regions of the country, and target to reach about 5.8 million people and 3 lymphatic filariasis endemic districts that occur in 3 regions, targeting about 440,000 people at risk. This activity commenced from July 15 to 26 of this year. As you can see, through the mass drug administration, we've been able to reduce transmission in a lot of countries for a lot of districts for lymphatic filariasis, but we still have a large challenge with onchocerciasis. Let us encourage all eligible persons concerning the need for NTD medicines in the fight against onchocerciasis, lymphatic filariasis, and other neglected tropical diseases, and rid our society of these infections that cause poverty and stigma.
Let's take you now to Tema because residents and commuters on the Tema Ponda Road are protesting the bad nature of that stretch. Now, they're worried about the number of hours spent in traffic and how much they spend to fix their cars. Carlos Caloni is on that beat and he has been speaking to them.
And we ask questions and we are not getting answers. And we want government to tell us what exactly is going on. The contractor must come back on site, otherwise they must tell us. We are ready to demonstrate. This is not going to be the last one. This is just the first one. And we are going to continue until we see something going on. We want to see action on our road. This is an international road, you know, and you have all the big trucks going up and down this road, and there's so much traffic. People's lives are in danger. A former MP died on this road.
In fact, I have a spinal issue as I'm talking to you right now. Because if I get out from my house and then I want to even go visit Tema, it takes me like 2 hours to reach Tema. The situation is just terrible. And as you see the Malaria, the runabout, they have created a runabout in such a way that it's becoming small. So cars, you know, there are potholes there. You know, there was a time they came and then they put some nitrite out there. It just rained 2 days and everything just went off. So in fact, we want the government to come on board to address this road. You see the tank farm. If there is an explosion right now, where will people go?
If the government can't do the road, give you, else you not go vote. Thank you.
How many hours do you spend in traffic?
I spend almost 3 hours in traffic. This traffic here, 3 hours before I reach school. And then my boss too, every day if I reach work, he talks. So I beg they should come and do the road for us. Else we will not go to work next time. Thank you.
You not go agree. You not go agree. Government, I don't know whether MPP, NDC. Yes. You guys to collaborate and do what?
Yeah, do the
road.
Well, in Parliament, there is good news for dual citizens wishing to hold certain public offices they were hitherto banned from occupying. The Constitution does not allow dual citizens to become MPs, hold office of the IGP, or become an ambassador or high commissioner. But a private member's bill is seeking to change that all and will be live in Parliament shortly for details. Our Minister for Employment, Labour Relations and Pensions, Ignatius Bafoiwa, has told Parliament NPRA has cleared Senate to proceed with its plan to sell 4 hotels to Rock City Hotel, owned by Brian Champon, who is a Greek minister. The National Pensions Regulatory Authority had asked Senate to put on hold the transaction after significant public opposition, but Senate now has the all clear to proceed. There's more in this report by Kwekwa Asante.
There has been intense public backlash over that controversial decision to sell 4 hotels owned by SNIT to a Greek minister Brian Champon's Rock City Hotel. That deal had been progressing until the National Pensions Regulatory Authority, NPRA, asked SNIT to pull the brakes and supply some documents on the transaction. Some Olokujotoa Blackwire and those who are opposed to this deal interpreted that decision as victory. But it appears that might have been short-lived because the minister has been providing updates on this transaction to Parliament today and says NPRA has now cleared SNIT to go ahead and sell those hotels to Rock City.
It said it needed to be furnished with all information relating to the sale of the hotels, which SNIT has since done that. As a minister, I can tell you on authority that NPRA has since indicated that they had seen the processes and they think that SNIT can go ahead.
The minister insists this transaction is in the best interest of the Social Security and National Insurance Trust.
The policy objective behind SNIT's decision to divest 60% of its shares in its hotel investment portfolio aligns with the primary goal of the scheme. The primary goal of the scheme is to provide monthly pensions and related benefits to workers in Ghana, ensuring their retirement income security. SNED's decision to divest is also supported by its funding and investment objectives.
As the minister provided these answers on the floor, the majority leader, Alexander Fenyomaken, and the deputy minority whip, Comfort Doyo Kujo, were locked up in this controversy. Listen for yourself.
Mr. Speaker, there is this saying that when dry bones are mentioned, old women get worried. Old women, Mr. Speaker, they get so worried and they get palpitation.
Treat with you to call the majority leader to withdraw that statement about old women. As of now, we have a president who is over 80 years. No woman has attacked him. So he should stop attacking women because they are aging. The men who are attacking us, that we are old, cannot do all night long. Mr. Speaker, they cannot do all night long because they are also old and they are hiding it.
SNED has now been given the all clear to proceed and conclude a transaction that will see it transfer 60% of its stake in 4 hotels, including the Labadi Beach Hotel, that some of the Kujota Black and others have said are quite profitable and should not be sold to Rock City Hotel. Despite concerns of conflict of interest having been raised against the transaction, SNED says it is going to go ahead and has now received the blessing of the pensions regulator, NPRA, to go ahead. Reporting for Joy News, Kweku Asante, Parliament House, Accra.
Well, we know that organized labor has called for an emergency press conference to address their concerns about Senate's decision to sell 60% of their stake to Rock City Hotel, owned by Agric Minister Brian Achampong. We'll give you details in subsequent bulletin. But the Health Minister and the Ghana Health Service says it has made strides in reducing malaria-related deaths in the country. Amid struggles, EcoBank Ghana, through its Zero Malaria Business Leadership Initiative, with the support of the Multimedia Group, donated $100,000 worth of items to the Ghana Health Service to aid the fight in hard-to-reach communities. My colleague Michael Ashali has more in the following report.
Malaria, caused by the Plasmodium parasite, leads to fever, chills and headaches. In the worst-case scenario, malaria kills. In 2021, it claimed more lives in Africa, particularly among children under 5, than in any other region worldwide. In Ghana alone, malaria caused the deaths of over 1,500 people from 2018 to 2022. Dr. Kezia Mam, who leads the National Malaria Control Program, says they have made more progress in reducing malaria deaths.
Last year, we recorded 146 deaths in our health facilities. That's a great reduction from the thousands in 2012. So we believe that if we continue the effort, we even heighten it, we should be able to eliminate malaria deaths.
Despite these gains, the number of malaria cases in Ghana has been on an upward trajectory for years, rising from 350,000 in 2018 to 438,000 in 2022.
So our goal is to eliminate malaria. We have 3 goals. The first one is to make sure that we have near zero malaria deaths. So that is our main goal of stopping malaria deaths. The second death is to bring 21 districts to the elimination point. That's the second goal. And then the third one is to reduce malaria disease by 50%. So we'll still have malaria in 2028, but we don't want to see deaths in 2028.
The Ghana Health Service faces the challenge of distributing limited funds across its many initiatives. Amidst these struggles, the EcoBank Foundation launched the Zero Malaria Business Leadership Initiative, a beacon of hope in the fight against malaria. Spearheaded in Ghana by EcoBank Ghana, Speak Up Africa, and the Multimedia Group, this initiative aims to rally corporate organizations to join the battle against malaria, providing crucial support where it's needed most. Dr. Daniel Kasati is the head of marketing and communications at EcoBank Ghana.
From studies, we have come to know how malaria is affecting everything. It's affecting work, it's affecting schooling, it's affecting general health. And if you see its impact, how devastating the impact is on even the GDP of nations, it's so amazing.
The initiative is now paying off after strategies were switched.
EcoBank started with initial seed capital of 120,000 USD, and we are working through the private sector participants to mobilize some more funds so that it will be sustainable going forward. So we are able to do more things than this. So for now, we have disbursed our 120,000 USD in procuring these 3 line items, the Toyota Hilux vehicle you see here, the digital microscopes, and then the electronic tablets.
Dr. Nsia Poku is the chairman of the Kina Group. As a champion of the Zero Malaria Business Leadership Initiative in Ghana, he says he will leverage on his wealth of expertise to rope in partners to support the program.
We can raise funds to malaria control program to help them to try and eliminate malaria in Ghana.
Meanwhile, he says his company is working to develop a bivalent vaccine which will be up for clinical trials soon.
I'm sure by the end of the year we'll start the clinical trials on that one. It takes about 3 years for the trials to be over.
The Ghana Health Service is impressed with the hefty donation.
These items donated to us are very good in the sense that it will help fill the gaps that we have in our efforts towards malaria elimination. Sometimes health workers need to do outreach, they need to go to the field to do particular interventions, but we struggle because we don't have adequate transport. We also have gaps in our data collection tools, so the tablets would really help us in filling those gaps.
Like other African countries, the coalition of companies in Ghana aims to raise millions of dollars to fight malaria.
With the Toyota Hilux, the microscopes and the tablets, it brings the Ghana Health Service and their partners a step closer to eliminating malaria in Ghana. For Joy News, Michael Ashale.
Well, tributes are pouring in for the former Dean of UDS School of Medicine and Health Sciences, Dr. Edward Gada. His selfless dedication to duty and love for humanity, according to his family members and friends, was legendary. He was nominated by the World Health Organization as one of the 65 most caring doctors in the world and received a knighthood from the Pope. Rafiq Salam visited his family's house in the following report. He tells us more.
The renowned surgeon consultant, said Dr. Edward Jedare, recounting his life as a young doctor at the Denwa Regional Hospital.
When I was here alone as the doctor, we didn't even have electricity. And I had to operate sometimes with torchlights. And I was the only doctor, administrator, nurse, everything. Today, something different has come. I'm very excited to be here. The only thing I pray is that the young doctors who are here, it's not going to be easy. I know.
The 79-year-old selfless surgeon consultant gave up the ghost during the wee hours of Wednesday. At his bedside was one of his mentees and medical director of the Upper West Regional Hospital, Dr. Robert Amesia.
No one can live forever, but we didn't expect his demise soon. This is a gentleman who has been very selfless, and his selflessness has been proven in many courtesies. He has won many awards from national to international, like WHO, for the most caring doctor in the world, one of the most caring doctors in the world. When we came to this region as young doctors, he mentored us. He frequently visited our various stations.
The news of his death sent shockwaves across the region and the country at large. Close family members, peers, schoolmates, and friends came to his house, located at Wachago, in droves. Many did not believe of the person of the man who they see as selfless and their mentor.
Because it's like I don't have any father again.
He's the one I started my career with. I ended my career with him. And I thought, now that I'm on pension, I'll be able to come and sit with him and we chat.
Being a guardian, a father, a provider, I actually traveled with him on Monday from Tamale to Wahia. And so I'm very, very shocked to have heard this morning about his passing. He has passed with a lot of knowledge, a lot of wisdom, a lot of experience. He's contributed a lot to the development of Namdom, to the development of the Upper West region, to the development of Northern Ghana, to the development of the entire country.
Because even where I sit every day, just doing some ala. He comes around, we chat, we do politics, and then we chat a lot. And he sees to my welfare, he sees to my children's welfare, he keeps asking of my children. So I've missed him, the family have missed him.
The septuagenarian pioneer Dean of the University for Development Studies School of Medicine and Health Sciences, love for humanity and selfless dedication to duty was legendary, irrespective of where he finds himself.
Even I tell you, this man, even in the bush, his passion was hunting. And he used to go to the bush to hunt at the weekends. And at one time in the bush, a woman was, to deliver, and the people could not transport the woman to the hospital. He did the operation there before transporting the woman to her. In fact, the late Jerry John Rollins awarded him for being such a surgeon. The passion, in fact, surgery was his passion.
Even on retirement and with mobility challenges, he operated patients sitting on a chair.
When patients came, his own hospital, he treated them and used money from his own pocket to pay the bills for those patients to be discharged. At his age, he was still conducting surgery and sitting on a chair just to bring life to people and put a smile on people.
Dr. Ian Jadare was well known to be a surgical consultant where he has treated and taken care of several people. And when he wanted to join politics and become the MP of the Lower Nandom constituency, the people refused to vote for him because they thought that if they vote for him, who will be taking care of their medical needs? And because of that, he couldn't go to parliament. He was a former chairman of the PNC and later rose to become a member of the Council of State. Dr. Ian Darare surely will be missed by the people of the Upper West region and the country at large. Reporting for JoyNews, Rafiq Salam.
You're watching JoyNews Today. We'll be back with business to stay tuned in.
It's time for business on JoyNews Today. My name is Winston Taki, and now to our first business story. Industries have linked the rising prices of goods on the market to the high cost of power. June 2024 data from the Statistical Service showed a significant spike in prices of goods produced in the country. But speaking on PM Express Business Edition, Finance Director at Crocodile Market, Dr. Charles Itiahene said, despite the power situation stabilizing, their fortunes are yet to improve.
From last year, it appears the price have gone up by 100%, and this impacting negatively on the unit cost of the product. That's the essence of the high inflation. No manufacturer, absorb the cost. It has to transfer onto the final user. So you could see that from June inflation, the producer inflation is about 25% locally. The imported one is about 17%. That's the impact. So when the electricity price goes down, obviously the unit price of item also goes down.
Even though it has stabilized, the cost
is too high.
Unit is too high.
It's too high.
And that is feeding into the high prices. Because I thought that if things were bad then, and some were saying that now that things are stabilized, it should impact on the cost of, in terms of your produce that you sell. But it appears that it's a reverse.
No, the impact of two folds, as I said. when there's no electricity, you have to rely on diesel to produce. Okay, diesel is quite expensive than electricity. However, another electricity is on the mainstream. Unit cost of electricity is also high. It's now we get 100% or say 95, percent, but the unit cost is high, and I'm saying that's why it's reflecting in the June producer inflation rate around 25%. Okay, so that's the essence. So it's available now, but the unit cost is very, very high.
Cocoa Processing Company has revealed, in spite of deliberate attempt to increase domestic consumption of cocoa-based products, a lot of more work is required. CPC says domestic consumption of cocoa-based products remains low. Head of Sales and Marketing Department at Cocoa Processing Company, Nana Ajman Anson, disclosed this at the Chocolatier celebrated World Chocolate Day with a Shaman cluster of schools. There is more in this report.
World Chocolate Day is celebrated on the 7th of July every year. Despite the health benefits of cocoa, the consumption of cocoa-derived products, and for that matter made in Ghana, leaves much to be desired. As a significant player in the production of cocoa, which is the main ingredient in chocolate production, the country, through Cocoa Processing Company, is taking deliberate steps to shore up domestic consumption as it continues to grow its markets externally. Cocoa Processing Company, as part of effort to inculcate consumption in Ghanaians, the chocolate manufacturer celebrated World Chocolate Day with a Shaman cluster of schools serving chocolate drinks. Head of Sales and Marketing at Cocoa Processing Company Limited, Nana Ajman Anson, says a lot more could be done to drive the consumption of cocoa-based products in the country.
Thankfully, we in Ghana here do not only produce cocoa or the raw beans, but we are also able to process it and manufacture cocoa confectionery products like bar chocolates, chocolate dragées, cocoa beverages, chocolate spread, and the like from the Golden Tree brand. And so we think that the children must have the opportunity to consume cocoa-based products because of the nutritional and health benefits that we gain from consuming it. And that is why we have chosen the children to introduce them and to continue to remind them about the need to consume cocoa-based products. And through this campaign, we've been able to increase the consumption of cocoa from a very low level. Today, we see more Ghanaians becoming aware of the health and nutritional benefits of consuming cocoa. And so we've come here perhaps with a concept of catch them young, so that as the children, we introduce them right from childhood, they will grow with it.
According to Nana Ajman Anson, the company is to open in basic schools despite having chocolate drinks consumed as part of the school feeding program at the senior high level.
Serving the school children, and that is all the senior high schools, over 600 schools were being given cocoa beverages in the schools. And that has continued under the school feeding program. And we at our level as a company, we are also making efforts to bring the basic schools on board by celebrating days like this to remind them, to bring their attention, to bring that knowledge about the existence of or the need to consume cocoa-based products.
That'll be all for business. Coming up next is sports.
Time now to bring you sports here on JoyNews Today with me, Muftao Nabila Abdullah. This year, Ghana will for the first time have a female represent the country in the women's high jump in Olympic competition. Rose Yeboah qualified after meeting the standard qualification of 1.97 meters, which she secured just about a month ago. She says she's excited to have qualified to participate in the global multi-sport event.
Qualifying for Olympics is such a great experience, and I'm really happy to see myself there to compete for my country, Ghana.
Tell me about your personal target. 1.97, new personal best for you, and you just keep going higher and higher and higher. What is possible for you in Paris?
I feel like my target is like I want to, jump above 197, like 197 and above. And I know for sure that I'm going to make it because looking at my performance I put up during the NCA, I feel like I'll do much better since it's going to be like a competitive among ourselves, and we already know each other. So it's really going to be a competitive one. So it's really going to push us. Do our best.
And Rose, you barely lose. Everywhere you compete, you win. You won at Mauritius, you won in Accra, you won in China, even NCA for the first time ever. A Ghanaian had become NCA champion. A Ghanaian woman had become NCA champion. Paris is waiting for you. What should we expect from you?
Ghanaians, like I'll say, everyone should expect me qualifying to the finals, and see myself in the podium. It will be such a great experience if at least I make it to the finals and at least get a medal. I actually didn't spend time with my family because I was in Cape Coast and I was training towards the Olympics because the training that my coach sent to me, the one who was supervising was in Cape Coast. So then I have to, go to Cape Coast and train. And due to the training schedule, I can't, go to Kumasi to see my people or my family. So that's what.
And the world record for the women's high jump is 2.10 meters, which was secured just 3 days ago. A 37-year record was broken. Rose Yeboah, who is seeking to jump that high to be able to win a medal for Ghana in the Olympic Games later this month. Now let's hear from Ni Dodo Ankra. He was Ghana's goalkeeper in 1963 and 1965 when Ghana won the African Cup of Nations title back to back. Well, in 2015, former President John Dramani Mahama gave each player who participated in Ghana's AFCON winning teams 1.8 million Ghana cedis. Many had said that the money was meant to fulfill a promise Dr. Kwame Nkrumah, Couture champion, promised the players if they won the tournament. But he says it is unfortunate if that money was meant to fulfill the promise of houses that were done many, many years ago.
We've won the cup. In 64, we're going to Tokyo and then at least come out with something. Then he said, now it is time for you to go and defend the cup in Tunis. Please, go there and defend the cup. Come back and houses will be ready for you. We were all very, very happy. By the grace of God, most gracious, most merciful, we defended the cup in Tunis and won. We came back. We are yet to go and tell him we have completed
the assignment.
Those things that we set our mind for, and then we have done what you expected us to do. Now we are coming for our reward. Not quite along, then there was that coup in Ghana here.
That's your sports. For now, we do have more sports stories on my joyonline.com. Join us tomorrow at 7:30 p.m. when we bring you the conversation with Ni Dodo Ankra. We appreciate your time.
Good
Good afternoon, welcome to the showbiz segment with me, Jacqueline Ansuma Yabwa. Now to our first story, a Ghanaian, Felicity Asantua, has broken the record for the most cars washed by an individual. Felicity washed 60 cars in the span of 8 hours. The event took place on March 9, 2024 during a car wash-a-thon. Now the initial record holder washed 55 cars, and according to the Guinness World Record website, Felicity broke it by 5. We had an exclusive with her this morning, and here are excerpts.
The records that you could break, but why washing a car?
I'm fan of car shows like Formula 1, so I needed to do something with the passion that I always look out to watch on TV shows. So I thought of cars. So when I got to their page to search for the kind of record I wanted to break, I had a category that I fit for.
And you applied for the most, what was it again?
Most cars washed by an individual in 8 hours.
Okay. And how many cars did you wash?
I washed 60 cars.
60? That's a lot. But then during the record, during the attempt, how was it for you? Whilst you were trying to break the record, during the time that you were washing all the cars, what was going through your mind? How was it?
Yeah, it was something I wanted to challenge myself and empower people who are looking up to me that time, to let them know that we can do it. We can do it. So.
Well, the full story or the full conversation will be available on all our social media platforms. Now, rapper Derek Safokantanka, also known as Amarado, has urged all musicians to be mindful of the lyrical content they create when recording songs. Now, this comes in response to the Ghana Education's new initiative of capturing the lyrics of artists as part of the questions in examinations, including the ongoing 2024 BEC. We have more in this report.
The introduction of a new subject, creative art and design, at the program CCP level in educating the Ghanaian child has paved the way for creatives, particularly musicians, strengthening the bond between the sector and the corporate field, as some artists are featured in the curriculum. In 2020, dancehall singer Shatta Wale was featured in the Creative Arts textbook meant for Class 4 pupils, but the idea did not go down well with most Ghanaians. They took to social media, trolling the musician and the publisher. However, the Ghana Education Service did not relent on their decision, as the latest to be featured in the 2024 BEC is rapper and singer Amarado and Black Sharif, respectively. With a portion of his song, Kukwananse, captured as a question in the objective session of the examination, Amarado is honored for the recognition of his hard work. Considering the impact of the initiative, the rapper urges his colleagues in the industry to be mindful of the lyrical contents they create when recording songs.
There are some people out there who believe that if not all, most musicians are rascals. They don't go to school. Yeah. Their music is not that impactful. They always do songs that's going to have negative impact on the society as a whole. So with this, it shows that what we are doing could go as far as being positively impactful on other people's lives. Yeah. So as an artist, if you are going to the studio to record a song, if you are going out to perform, you should check your dress code. You should check the way you portray yourself, the kind of words that you use in your song, because some way, somehow, you are leaving out impact on people's life. And I believe that with somebody like me who is very conscious of making positive music, this helps to connect the corporate world and we, the musicians, who are seen, quote unquote, as rascals. Yeah. But now we have a question like, in the Ghanaian BEC question.
Black Sharif, on the other hand, has been featured in Paper 2 section of the examination. Students were asked to choose and write short notes on the lives of the listed composers, including Black Sharif, Ephraim, and Ejakonimo. This was the first time junior high school candidate for the BECU are taking an examination on the subject since its initiation into the curriculum. Creative Arts and Designs provides opportunities for a learner to self-explore, self-express, build mental focus, skillfully use hands to create, manage and reduce stress, and achieve personal satisfaction and enjoyment. Joanne Nyame's report, read to you.
Well, it's a wrap for the showbiz segments with me, Jacqueline and Sumayabwa. Over to you, Faustina.
For bringing us showbiz. Well, congratulations to Felicity. She did an amazing job because we didn't give her that much publicity.
I didn't hear about it.
You know,
no,
like Asantua, we gave her so much publicity, but unfortunately,
Chef Smith, we gave him
publicity. You know. So it goes a long way to say that when you work hard in private, people end up seeing your work in public. Well, that's it for Joy News today. For more news, please log on to myjoyonline.com. My name is Faustina Savo. Have a pleasant day as you enjoy the rest of our programs.